So what's unique about what we do for healthcare professionals, certainly with our in-house training as well, is just to make sure that we actually deliver everything that meets the challenges for you as an individual organisation.
When we come in-house, what we do first is we listen. We really listen to the problems you have, the challenges you have, where you want to get to, and then we put together a bespoke package that works for you.
So if you like, they practiced what they preached. They did it naturally and instinctively, and I thought that was a real gift that was being given to Braintree if we were to commission them. And it was probably the one decisive factor within 2-3 minutes of meeting them that made me want to engage with them further and explore possibilities and opportunities.
It's given me a personal insight. It's given me an insight into the way that my team works. For myself, it's shown me how I can project, or how I can be perceived to project in myself.
And what we found was people working typically in most hospitals in functional silos, and what I've noticed now is people engaging with each other, looking at joint resolution to operational day-to-day problems they might be having, perhaps looking at long-term problems they've had that they sort of failed to sort of react to proactively before. Certainly a lot less blame culture around, and there's an energy about this place that you can't describe really.
The team are a bit more forward. They find it a bit easier to come to me to make suggestions. So as the team, they went down to B&Q, they bought the tapes, that were different coloured tapes, and they started marking off the store cupboard so that it was all set up. They wouldn't have done that before. Joe and Andy are very good people to communicate with. Their training would be an asset to any company. As long as the company realise what they're getting from it and utilise that, it's going to be very good for them.
What's really different about our public workshops is that they're really fun and they're really interactive and they're challenging. Working with a group of other healthcare professionals, you get to really discuss your current challenges, taking the techniques and tools that we give you and discussing how you can apply them.
In that fun and challenging environment, you're really going to learn the most, because you want to be challenged yourself to make sure that you can shift any of those limiting beliefs and do the things that you really know that you can in your heart do. So it's now Sunday morning and you're in surgery.
Try and get into work early,
yeah,
and try and quantify the amount of work that I have to do.
Because as a leader, you're going to have to make decisions, aren't you? Yeah? And not all of those decisions are going to be liked by everyone.
Okay, what's the last time?
To move members of your team into the most productive state is to give feedback and to ask for feedback back. You've been great giving us feedback today in various measures about various things, not just the temperature of the room.
Yeah, it's the second time I've attended. I found it again very useful, well timed, informative as last time, and I am seriously considering coming along to the overall course.
A really special part of our practitioner courses is that we keep the groups really small. We keep it so that you really get your chance to have individual coaching from myself and Andy.
Particularly today, I had a particular issue that's helped me to think through it, and I actually find using the steps to get to the outcome, thinking of the outcome and then the steps to get there, really useful.
It's really unique that you'll be able to take what you learn on the courses forward into your working environments and use it with patients, clients, and of course with yourself.
If you analyse what you do on a day-to-day basis and analyse your relationships and analyse what you say to people, without giving too much away about the course, NLP really helps you to think about things before you actually do them.
Absolutely get them on board. Grab them as soon as you can. Why would I say that? Well, I think there's a number of reasons for that. First thing is they've got a range of technical skills in their toolbox that they're able to impart and share with people. They can work with people on those tools at a range of levels in the organisation, from people who are comfortable and familiar with working at that sort of level to people who it's a whole new language, and at every stage they flex and work with you without judgment.